You guys gonna get started? Good evening, everyone.
Good evening. Um, where's the council president at?
Mr. Tote, how are you, sir?
How you doing, Councilwoman?
Can't hear you.
How are you doing, Councilwoman?
Doing well. You should have been a busy day for you today.
Oh, really? You guys kept me real busy today. Thank you very much.
You're welcome. I'm glad you earned your paycheck today, sir.
And some. I earned a raise too.
You got a raise too.
No,
Wow.
I need one for how I
Oh,
work
okay.
today.
Well,
Good evening, everyone, and thank you for joining us this evening. I am calling this regular virtual public hearing of July 10th, 2023 to order. This evening on my screen, as I see them, are my council members, which are Councilman John Gale, Councilwoman Tiana Hercules, Councilwoman Shirley Surgeon, Councilman Amilcar Hernandez, Assistant Majority Leader Marilyn Rossetti, Councilman Josh Mixtum, Majority Leader TJ Clark. We also have our town clerk, Mr. Noel McGregor, members of Hartford Public Access TV. From the Office of the Council President, we have Sibel Moyes, and also is well, I don't see her anymore. So thank you for being with us this evening through our public comment section. I just want to read out some housekeeping rules. Public comment shall be conducted in accordance with the following procedures. Each person wishing to address the council or committee therefore shall, upon recognition by the presiding officer, give his or her name, address, and if he or she represents a group, shall in addition state for the record the name and address of said group or organization, and shall limit his or her remarks to 3 minutes. All remarks shall be addressed to the council as a body and not to any individual member of the council. Any persons making personal, impertinent, or slanderous remarks or who becomes boisterous while addressing the council shall be forthwith barred by the presiding officer from further audience at said meeting unless permission to remain is granted by a 2/3 votes of the council members present and voting. During public comment, there shall be no debate by the council, although questions may be asked by a council, a person making such presentation. For members of the community, please be advised that this meeting is being broadcasted and recorded by Hartford Public Access Television and can be viewed via Hartford Public Access TV Facebook page, Comcast, Xfinity Channel 96, www.hpa-tv.org, or Channel 6032 for Frontier customers. Spanish interpretation is provided through a partnership with the City of Hartford and the Hartford Public Library. Additional accommodations can be made with enough notice to the Office of the Council President. This evening, we have 12 members of our public who are going to address the council body. And I am just pulling up that list. And the first person to speak is Mr. Max Katori. And Councilman Gale, as usual, you're our timekeeper. Would you be able to be our timekeeper for this evening? Great. Mr. Max Katori, you have the floor.
Thank you, all the council people, for giving me this opportunity. I came to Hartford when I was 25 years old and bought Star Hardware. It's really, really sad. I'm 60 years old today. We had to close Star Hardware because not because of the rain, not because of the water coming from other places. It was strictly closing because of mismanagement by the city and the housing authority. And it will be clearly laid out as the days go by that there is a massive amount of incompetency in what management is going on. And I would like to draw attention. I have come before this council in my 25, 30 years in Hartford, maybe 3 times. And the point is, I'm come to you today with a heavy heart. Hartford's oldest hardware store is getting closed because of incompetency of people. And I would love if any individual council person wants to know individually, reach out to me and I'll be glad to show you around as to what incompetency is. I have specific 3 or 4 examples. Today in this city, if you are an elderly minority in North End of Hartford and your house gets flooded or sewer gets back up, they give you $7,500 if it gets flooded. The point is that even when they send a contractor for the $7,500, there are plenty examples of people who keeps getting reflooded with whatever action steps that they are taking. Some people are being given a sump pump, and they're expected to clean it themselves. While if you call MDC and say, I've got a sewer backup, you will see people coming in hazmat suits, fully covered up, full kind of protection and bacteria, while we expect our elderly, especially in the North End minority folks, having to deal with this on their own. Specifically, we spent $800 million to $1 billion trying to clean up all of Albany Avenue, lay new pipes. If you go on Albany Avenue, just day before I attended a meeting at the Methodist Church, it has been flooded 3 times. I need the council to really understand that there's massive incompetency going on, and it is not just about this environment. And it is true, but it is not just about that. So I really would like to reach out to the council and tell you, we really need to relook at this issue. There is massive incompetency going on within the city on how we are managing not just flood, but the incompetency with the MDC and our relationship. And that's really my statement. I really am thankful to everybody, Hartford community, and some of the council people that have reached out to me. Thank you for your warming sentiments that you sent to me. Me and my family are truly thankful, and hopefully we'll get through this. Thank you again.
Thank you, Mr. Katori, for your comments. And as you stated, we have ongoing conversations. Thank you for your comments.
Thank you.
Next to speak is Victoria Fanal. Okay, we'll come back to Victoria. Bridget Rivera.
Yes, I'm here.
Hi, you have the floor.
Okay, thank you. Hi, everyone. Good evening. Thank you for being present. I am an organizer with Make the Road Connecticut. I'm also a Hartford resident for more than 10 years now, and I'm here to support access to healthcare, the resolution. I think throughout different times in my week, I always sit and listen and support various members of the community of Hartford. With me, they share their hopes, their struggles, and their experiences when going to clinics and hospitals. I think most memorably was the experience of a mother of 3 children who was born in Mexico and was living in Hartford for years and was seeking tubal ligation. She was 100% sure of her decision, but the hospital seek service from was not very supportive. They recommended her other birth control without acknowledging her wants as a patient. She had no health insurance and no other health practice was willing to take her in without the health insurance. So she actually had to end up going to New York to seek the health services that she needed. That's why accessible automatic information on resources at the local and state level of providers or of other health centers who offer care at low or no cost is essential for our community, especially the immigrant community. Following me, you'll hear and see a few of our leaders from Make the Road share a moment where health facilities failed them, but know that there's more stories to be heard, and allow this to be the beginning of an ongoing process where community members work hand in hand with hospitals and clinics to improve their accessibility, affordability, and quality of health. So I urge you to use your power as a city council to bridge this gap between hospitals and the community members' needs. Thank you for your time and for your devotion to listen. I will also be interpreting for other people on the list, so just a heads up.
Sure, and thank you for your comments. Next to speak is Ines Beverly. Did I say that right, or is it Hines Beverly?
Hi, good afternoon, everyone. Yes,
Hi.
it's Hines Beverly.
Hi.
Okay, good evening, everyone. Today is July 10, 2023. Almost a year ago, we met at the Public Works, Parks and Recreation Committee of the City Council virtual meeting on August 10, 2022. In that August 10 meeting, I specifically shared that I was representing the Weaver High School PTO and that no one, neither parents, staff, faculty, nor the immediate community in the vicinity of the Weaver High School knew anything about the easement being sought by the University of Hartford and CNG to run a gas line on the Weaver High School to power a fuel cell at the university. On August 10, 2022, the committee decided then to postpone the 824 review process until the University of Hartford and CNG met with the school and community, as that was a legal requirement of the process. On Monday, September 12, we received notification that the meeting scheduled for Wednesday, September 14 was canceled. On September 12, as a last minute supplemental agenda item, it was discharged from the committee to be voted on, despite the fact that Councilwoman Rossetti gave her word to hold it in the committee until University of Hartford and CNG did their community outreach. They did not follow state laws. After September 12, there was a deadly silence. No other communications on the subject. Fast forward to May 2023, this item was up at the Planning and Zoning Committee for decision making. On May 23, 2023, it was again brought to light that no community outreach was done. I learned on May 23 that the City Council had changed the committee without notification in September 2022. When asked why no one bothered to resume communication, the question kept tossing around like a hot potato. Again, it was decided on May 23 by the Planning and Zoning Committee that University of Hartford and CNG needed to do their community outreach. This time they did decide to follow through with this request. However, the meeting was not organized until a month later on June 28, 2 weeks after school had closed for the summer break. It was at that meeting with the University of Hartford and CNG that it was disclosed that the easement had been granted from September 2022 without the knowledge of the Weaver High School family and the community. This clearly explains why University of Hartford was dragging their feet, because they had already achieved their goal. My question this afternoon is, why is this underhanded behavior? Last year, I did say the whole thing felt like a backdoor deal, and now I have even more reason to believe that. What is the legal requirement of a project of that nature? Who is accountable for this? Who were the members who voted on this? When University of Hartford and CNG finally met the school staff, the parents were not available. The handful of people who made it through.
Substitute resolution for 6.2 stadium.
Beverly, excuse me for a minute. Can you mute? Mr. Clerk, you're on. Can you mute yourself? Thank you. I apologize, Beverly. Go ahead.
Okay. When University of Hartford and CNG finally met, the school staff, the parents were not available. The handful of people who made it through the outreach of the BHCA didn't include most of the people impacted. So then we are back where we started. If the people we're depending on to make the right decision concerning matters that affect the quality of our lives are moving so underhanded, it makes me think seriously, what else might be slipping through the cracks?
Beverly, Miss Beverly, I'm sorry to tell you that your 3 minutes are up. We'll be more than happy to communicate with you via email and respond to your questions, but I am allowed to give everyone a fair 3 minutes, and we have a long list this evening.
Thank you.
Thank you for your comments, but we will reach out to you. Thank you.
No problem. Thank you very much.
Okay, bye-bye. Next to speak is Dr. Deutsch, Larry Deutsch. You're on mute.
How's that? Can you hear me now?
We can hear you.
Wonderful, and greetings to everyone. I also see a message, the internet is unstable where I am, and also first I want to give great credit to all the preceding speakers, whether it be about the MDC or communication. Uncharacteristically, I will actually read a statement prepared in addition, and time it the old-fashioned way of 3 minutes. I hope it works. I would like to say that years ago, when I was doing medical rounds at a VA hospital, there were many men in a large room, and one of them was a white man who was hard to find against the white sheets. That was the comment. His skin was also white, but not even pink because he had worked many years as an auto body painter exposed to benzene, toluene, and other chemicals. The point of these mentions is that he no longer had his red blood cells because he had aplastic anemia as a result of long-term exposure to some of these chemicals. And what we're getting at, of course, is that those exposures can give blood cancer, loss of red cells, and difficulty breathing, and even heart failure. Now, what's the relevance to what faces our city council right now? It's the idea that we had passed an ordinance in order to have checks and licensing and careful measures taken in the nail salons within the city. What we have found, and the federal government has found, and EPA and OSHA, is that some of the chemicals used in these nail salons are very dangerous for those who visit there, but even more so for those women who work there day in and day out. So I give a reminder that we passed a health ordinance in 2017 for nail salons as well as barbershops, and that many times the polishes used on nails in these salons are toxic or poisonous and can result in those things that I just listed. All this is documented in the EPA, the OSHA, federal agencies, state agencies, and certain cities and states have careful regulations to make sure there's good ventilation of the nail salons. We find it absolutely essential to have regulations, and Hartford has passed it but not enforced it. Some states and cities have such regulations, and the answer, of course, is prevention of those diseases, and the easiest way to do that is good ventilation, not just the little fans at the side of a chair or those blue masks, but thorough ventilation of all these vapors out into the air, with fresh air being brought into the nail salons. We think about these women and men who go to these small salons and will breathe in these toxic vapors. It's very bad for their health long-term, and they may be immigrants, they may be uninsured, they may not be unionized, and they also may need the income, so they keep working there. So I'd like to wrap it up, of course, as is the time. There are some ways to meet these. The cities can enforce their ordinances, of which mine has been sent several times to city council members, and anyone listening can ask him or her on city council to forward these 4 documents or so to you, and you can read them yourself. In order to remedy the ventilation, we can hire city
Dr.
residents.
Deutsch,
Yep.
I'm sorry to interrupt you, but you know the rules, we've given you almost 5 minutes.
I don't think so, at least not by my timer. I'd like another 1 minute, if I may, please, Council President. We can hire city residents.
Dr. Deutsch.
We can, yes, and we can.
Dr. Deutsch, you can send us an email. I need to be fair with everyone.
I think
It's
people
going
need
on
to
5
hear-
minutes.
I think people need to hear it's a matter of life and death. It literally is for city residents, and community people can make sure, as well as the city council, that these regulations are carefully followed, just like the recommendations of federal agencies and other states, so that Hartford doesn't fall behind. Thank you very much, and let's keep at it until we have a safe environment for all.
Thank you, and thank you for caring so much and for always participating in our comments. Councilwoman Hercules, I saw your hand was up. Did you have a
Yes,
question for Dr. Deutsch?
I did, Madam President, and thank you. First, thank you for your comments, Dr. Deutsch. We appreciate your passion around this issue, and I'm sure all of my council colleagues would agree that it is an important one. I was just wondering if you wouldn't mind pointing to 3 very concise, actionable things that we could do in the immediate future to implement this ordinance.
Yes, I'd love to do that. There are 3 things. One of them is when they're inspected, you can put stickers on the window, just like for a restaurant that has failed inspection. It gets a B or a C. If you find a nail salon that has been careful with ventilation, they would get an A, acceptable. If you find that they get a D, that's dangerous and unacceptable. So certainly that's one that is simple. We can hire local residents to install correct equipment, not just little fans, and to try to keep people safe and healthy, and work with special grants. For instance, there are small business grants there's the state, the city, the federal government, all of which would have programs that we, or I should say that city council can, and its departments, the health department and so on, can diligently work to apply for and get in a short time. Because my last statement is, the longer we wait, the more women largely will die. That's all there is to it. They will suffer these diseases and they will not survive. So we need to act quickly, I think. We have the ordinance, let's do it.
Thank you, Dr. Deutsch.
Thank you. Next to speak is Victoria Fennell. I see she's back on the screen. You have
Yes. Hello. Thank you, Councilwoman Rosado, and thank you for the opportunity to the council members to speak this evening. I'd like to talk to you about the matter of a blighted property located at 25 Cornwall Street in Hartford's Blue Hills neighborhood, of which I am a resident, 21 Andover Street, Hartford. Right now, and I think over time, the property has become overgrown with grass. The building is boarded up, and as of late, it's become a dumping ground. I think, and if I'm not mistaken, I went on the city's website and believe that this is a job for the city's Development Services Department, the Blight and Remediation Team, maybe even code enforcement, housing code enforcement, not sure, maybe both. But my question is, you know, people are driving by, people are looking at this, some of our council people that live in the neighborhood, what are we gonna do? This thing needs to be cleaned up. You know, we spend a lot of money in this city. We're being charged very high property taxes. And this kind of blight really brings down everybody's property values in the area. So I'd like to see Development Services get a move on this, and let's get this cleaned up so that, and at some point, get the property developed so that it can serve the neighborhood rather than just a vacant lot, a vacant building, an eyesore. Let's have something that the neighborhood can be proud of. So those are my comments at this point. Thank you for allowing me to speak.
Council President.
Thank you for your comments. Councilwoman Rossetti, you have the floor.
Victoria, could you say the address again?
25 Cornwall Street.
Thank you.
Thank you.
Councilman
I've got
Clark.
a question. I've got a question for Vicky.
Oh, okay.
Vicky, have you reported? I'm sorry.
Go ahead, Councilwoman.
Thank you, Vicky. Have you reported this to Public Works?
No, I haven't. I tried calling the 311 and I was on hold for so long, I just gave up.
And how long ago was this?
About a week ago.
Okay.
Okay, so you want me to contact Public Works?
No, I was just asking if it was ever reported to Public Works before. Okay. And number two, so you told me, a week or so ago, and then that seems to be a private property. It's not a city property. Is that correct, you think? Or do you know?
I don't know at this point.
Okay.
I only know I'm also responding to complaints that I'm getting from people in the neighborhood. So, when people tell you things,
yeah,
they don't ask whether it's public or private. They just say, I don't like what I'm seeing.
Understandable. No, understandable. But it'd be great, when they call and complain, if you also, I know, 311 is pretty active, but do also help us by, for us to help them, by, reporting this to the, 311. And I can say if it's not taken care of, then you can say, oh, wow, something is going on.
All right, so get it. So 311 first and then Public Works, or 311 and let them decide.
That's what we normally would do. People normally call 311, including myself, and report the issue. The way the 311 system works all depends on the department that the issue would affect. If it's DDS or it's Public Works, whichever department, the 311 department then reaches out to those department with the complaint and, should follow back up with the person to say, the complaint was lodged.
Okay, and if it is private property, what happens at that point? If we
normally the city can go in, possibly clean it up. I don't know the rules and regulation, and then probably bill the property owner.
Okay.
So I don't know.
Council President, through you, we just looked it up. It's owned by a company in New York.
Okay.
They bought it in 2020.
No, that's that's incorrect. I was going to speak to that after.
They don't have the right thing in here?
Well, can I finish my comment,
Oh, I'm
please?
sorry.
Thank you. And
Okay.
so, Vicky, basically, that's the process for, using 311. We will certainly pass on to, Janice Castle and let her
Yeah.
know, the length of your hold, that it was very difficult, to hold that long to report the, report the concern.
So if it is an out-of-state firm, now what happens? Let's say that do we know the process of how they go after the out-of-state?
Okay. Maybe Councilman Clark can answer that specific question for the legality.
Thank you. Appreciate it.
Sure.
Majority Leader Clark.
Thank you, Vicky. Both Vickies, good to see you. You both. I do know that this is on the radar for BHCA. I did speak with one of the outreach persons. I did make a phone call. It is a blighted property, overgrown vegetation. I did make a phone call to DDS because DDS is responsible for the cleanup. So to answer your question, Ms. Fennell, if they are an out-of-state person, they would be contacted by DDS because DDS has to contact to all private properties. I was told that it is under the ownership of Shelbourne. And so since it is, in my estimation, with these high overgrown weeds, meets the criteria for the blight reduction team, which is under DDS to contact them and then to provide enforcement. So that is a process that they have to go through under DDS. However, I think it does warrant an expedited process because there was somebody that did partially mow the lawn over at 25 Cornwall, but they did not complete the job. And so I can actually contact DDS tomorrow because it does not seem like that any type of contact information was provided to the property owner. And so it is something that does need to be taken care of immediately because of the fact that it's already passed the city's criteria under the municipal code regarding overgrown vegetation and weeds. And so there are ordinances on the books regarding that criteria to impose these $99 a day fines so that the city in turn, so the process would be the city levies these fines on the property owner, the city's team goes out to take care of the property, then they all issue the fine to the property owner, and then I think it's by way of a lien that's placed on the property until they can until they will resolve that issue. So that's the truncated version of this of the blight remediation team process, but definitely I will make contact tomorrow. If not, not tomorrow, I'll make contact tonight, actually. So I'll do that.
Appreciate that. Thank you. We appreciate it.
You're welcome.
Councilman Hernandez.
Hi, Victoria. So based on my own experience, if you still want to contact 311, the best way, based on my experience, was to do it through their website, through their application, the 311 application, the mobile app. Once you create a case, it gives you a claim, like a case number. And then as they work on that case, you start seeing updates on what they've been doing with that particular case, which is a little better than calling them, because now you have a track record that you could see in writing that you did place the case this day, and it kind of gives you status updates. I did that for other properties, and I can see the updates. So if you decide to do that, I think that's the best way to go about it.
Okay.
And you do get an email and a response. At least I got 4 days. I got a response that the team was looking into it. So at least you get some sense that somebody's doing something, you know?
Okay, great. Thank you. Thank you. I appreciate that. Thank you for the explanations, both council people. Thank you.
Thank you for your comments, Vicky. Next to speak is Bridget Rivera.
Are you sure? Because I already spoke.
Okay, hold on. Someone just sent me that information. Hold on. Okay.
Um,
Gisela Luna?
Oh, yes.
Okay.
Good afternoon. Wait. I would like to thank the committee members for being present today. My name is Grisela Luna. I'm a leader with the Make the Road Connecticut Fight Back Committee, and I am in favor of the Access to Healthcare resolution. I'm a daughter of immigrant parents. Day in and night, I have seen the hard work and countless struggles my parents have faced working every day of the week, making sure that people have food to eat. They went from working in Florida fields to Connecticut orchards. Not having healthcare access constantly made them neglect their own health needs. I've had to be the interpreter in hospital rooms and clinic rooms on multiple occasions, whether it was for my grandfather receiving cancer treatment, my own hospital visits, or trying to figure out questions about insurance for my parents. The majority understands that we can't ensure a healthy community until everyone is taken care of. Sickness doesn't just happen because a person doesn't have immigration status. We can all get sick, and when we do, we must ensure one of the most vulnerable populations is being supported. Thank you for your time.
Thank you. Next to speak is Imelda Barajas. Did I pronounce it right? Okay.
Yeah, and I'll be translating for her, but she'll say in Spanish. Aquí está.
Buenas tardes. Mi nombre es Imelda Barajas. Soy madre de familia y vivo en Hartford. Soy indocumentada. Apoyo la resolución a la atención médica y espero que ustedes también lo hagan. Tuve una experiencia muy traumática hace aproximadamente 10 años atrás. Yo tenía un dolor muy fuerte en mi estómago y era tan y tan fuerte el dolor que mi esposo decidió llevarme a la sala de emergencias del hospital de Hartford.
Yeah. Good evening, everyone. My name is Imelda Barajas. I'm a mother and I live in Hartford, Connecticut with my family. I am a docket and I support the Access to Healthcare resolution and hope you will too. I had a very traumatic experience in the emergency room at the hospital in Hartford. I arrived with a very strong ache and it made me freeze up from pain. My husband tried to comfort me and hug me, but the pain was just too much.
El dolor era tan y tan intenso que yo me ponía helada cuando me daba ese dolor, que apenas sí pude entrar a la sala de emergencias. Mi esposo casi me tuvo que llevar en brazo.
The pain was so intense that I was barely able to make it to the entrance of the hospital. My husband had to carry me in with his arms.
Cuando yo llego ahí a donde ellos estaban tomando la información, estaban 3 personas detrás mío. Cuando yo llego ahí y entonces no había mucha interpretación. Como pude a señas, le tuve que decir porque mi idioma materno es el español. Entonces, como pude a señas, les dejé saber cómo yo me sentía.
When I arrived, they sent me to the front desk to give the information, and there was 3 people behind me. And at that time, there was limited interpretation, and I had to use gestures since my primary language is Spanish to tell them what I was experiencing.
Yo pensé que al verme esta persona, lo mal que yo me sentía y lo mal que yo me veía, pensé que él me iba a pasar a un cuarto para que me pudieran dar algo para poder aliviar un poco el dolor, pero no. Lo que él hizo fue decirme a seña que me tenía que sentar en la sala de espera.
I thought that having them see me and how bad I was feeling, I thought they would allow me to see a doctor right away since the pain was great. But they said no, they just sent me to the waiting room.
Yo llegué allí aproximadamente a las 9 de la noche. Yo no sé cuánto tiempo pasó. El dolor era tan y tan intenso que yo creo que mi cuerpo se anestesió por el dolor. Yo no me daba cuenta de las cosas, pero mi esposo me decía, mira, están atendiendo a estas personas que llegaron después de ti y a ti no te han atendido?
I got there at 11 p.m. and I'm not sure how much time I spent there. I think my body went numb because of the pain, and I didn't realize, but my husband would notice that the people that were behind me were being brought into the hospital and inside to see a doctor before me.
Estaba yo tanto y tan con ese dolor que me tenía tan mal que yo en ese momento no pensaba ni me preguntaba por qué ellos no me habían atendido. Mi esposo, al verme tan mal, se tuvo que levantar e ir a preguntar por qué ellos no me atendían si yo estaba tan mal.
I was in such pain that I didn't realize the reason as to why I wasn't being attended. My husband had to go ask the desk why was I not being brought to the doctor while other people were.
Ellos hicieron caso omiso a eso. Él regresó y se sentó conmigo otra vez a esperar. Entonces, cuando después de eso estuve hasta las 3 de la mañana cuando mi esposo me dijo, ¿sabes por qué no te atienden? Tal vez porque tú no tienes seguro médico y están atendiendo a los que tienen seguro médico.
They didn't give my husband a response, and my husband just sat back down to sit with me. And I was there until 3 a.m. When my husband just said, perhaps they're not serving you because you don't have health insurance, and the people behind you actually did.
Yo el dolor era tan y tan fuerte que yo creo que por momentos yo me desmayé del dolor. Yo pensé que era como que había entrado en un sueño, pero no. Me desmayé del dolor que yo sentía. Yo pude haber muerto en esa sala de hospital y ellos fueron tan inhumanos que ellos no tuvieron tan siquiera decir si cómo yo me sentía. No, ellos no lo hicieron.
The pain was so great that for a moment I passed out and I thought I was sleeping, but I wasn't. I passed out. I could have died in that waiting room, and the people who attended me didn't see the humanity in me.
Es tan triste pensar que ellos fueron tan inhumanos que a mí me vieron como si yo fuera un objeto. ¿Por qué? Tan solo porque yo no tenía un seguro médico y yo no tenía derecho a la atención médica. Por eso yo creo que no es justo que nos traten así. Somos seres humanos que sentimos, que pensamos. Yo le doy gracias a Dios que estoy aquí, pero yo pude haber muerto ahí.
It's so sad to think that they only saw me as an object just because of my health insurance. It's unfair that they treat us like this. I'm a human being and I could have died in that room. Ya, tu tiempo se terminó. So, la última cosa que quieres decir.
La última cosa es,
lo que se te venga.
Esta resolución significa el inicio de una conversación para que otras personas no tengan que enfrentar lo que yo pasé. Visualizo tener instalaciones de salud que me apoyen como ser humano. Me merecía interpretación, merecía que me informaran sobre su programa de asistencia financiera, merecía algo mejor, pero no entendí eso y ahora estoy luchando para que esto no vuelva a suceder. Esta resolución significa compromiso para mí, significa que la gente se preocupe por nuestra comunidad inmigrante, significa el comienzo de una conversación y cambios realmente honestos. Gracias por su tiempo.
Okay, her last remarks were just that this resolution means a lot to her. As a start of a conversation, she deserved a lot more. She deserved interpretation and to be treated as a human being. And she appreciates the opportunity to speak with you. But this resolution means commitment and for folks to actually care for the immigrant community and have a real conversation and create changes. So thank you for your time.
Imelda, es triste por lo que estás pasando, y lo siento mucho. ¿A qué hora tú llegaste al hospital?
Yo llegué alrededor de las 9 de la noche y estuve ahí hasta las 3 3 de la mañana del día siguiente y ellos nunca me atendieron.
Okay, so, ¿cómo que nunca te atendieron? Cuando llegó a las 3 de la mañana, ¿qué pasó?
Yo me tuve que salir, mi esposo dijo, ¿sabes qué? Ellos no te van a atender, como que mi cuerpo se anestesió por el dolor. Y dijo mi esposo, ¿ya se te pasó el dolor? Sí, se me pasó, pero yo sentía mi cuerpo dormido. Entonces él dijo, ¿sabes qué? Vámonos, ellos no te van a atender. Vamos a pasar a Walgreens a comprarte unas pastillas por si te vuelve el dolor. Tenemos algo para darte. Vámonos, porque ellos aquí no van a hacer nada por ti. Y eso fue lo que hicimos, irnos a casa.
¿Cuándo fue esto?
Eso fue hace alrededor de como 10 años atrás, que era entonces cuando no había muchas personas que hablaran español, no había intérpretes. Entonces eso también fue una gran barrera para mí, pero eso no tenía excusa para que ellos no pudieran darme algo, no sé, atenderme o tan siquiera tener un poquito de compasión.
Okay, so let me translate for my council colleagues. So I was just talking to Imelda, and you know, I told her I was very sorry for what she had gone through. And I also asked her when this happened, she said, when she got to the hospital, and she said it was 9 o'clock at night, and then 3 o'clock in the morning, her husband said, let's go. And this happened 10 years ago to her. Is there anyone in this group that's there that has been recently to Hartford Hospital and has had a situation like this happen recently? Okay. Council.
Oh, hold on. I was translating the question.
Oh, okay.
The answer is yes.
Okay. Okay. So I will have a offline conversation, you know, with the group. I did ask my office to reach out and set up a Zoom call with you guys, okay? Councilwoman Surgeon?
Thank you, Council President. Through you, Council President, to the group, you know, several months ago, they reached out to Councilman Nick LeBron regarding their issues and concerns, you know, and they met with Councilman Clark and myself because we weren't getting anywhere regarding getting a resolution from the council. I have to thank all the council members who actually understood the plight of what has happened to the immigrant community. When I met with them, I told them, as also, you know, being an immigrant myself, I certainly could relate to their issues and concerns. And when all the council members saw that resolution that was written by them in support of it, all the council person, you know, immediately wanted to support them and their issues. So, you know, they're here to thank all of us, you know, for their concerns, that we all understand their plight and what they have gone through. You know, Councilman Clark was a little bit more involved, more than myself, because he's got more of a, you know, health background more than myself. And so Councilman Clark actually really worked with them to get this resolution of support. And also, more than anything else, you know, thank our aide, Sadea Lee, who worked with them for weeks back and forth on drafting this resolution and working with the new upcoming health director to make this resolution comprehensive going forward. So I want to thank them for bringing their concerns to us and whatever we can do to help them. Thank you, Council President.
Thank you, Councilwoman. Assistant Majority Rossetti, you have the floor.
Thank you. Thank you, Councilwoman Sherlin at Surgeon and Majority Clark. But I do want to bring up that, you know, I met with them early on, and unfortunately I had passed them on to Councilman LeBron because he chaired Health and Human Services, and it's my fault that it did not move further. But I also want to know, I want them to know that it wasn't for a lack of my lack of interest or the severity of the situation. So I'm glad that my colleagues picked up where something got left off. So thank you very much.
Are there any other comments or questions? Okay, thank you. Next to speak is Esther Alcantara.
Yeah, she's here. Let me see if I can do it in English. Oh, ¿lo vas a hacer en inglés? Yeah, well, okay. Good evening. Thank you for the commitment members for being in person. My name is Esther Alcantara. I live in Hartford, Connecticut. I'm also a leader with the Major Role Connecticut Fight Back Committee, and I'm in favor of the access to healthcare resolution. I came to the United States around 6 years ago, the same time that I remember having the joy of my first child. And at the same time, the pain of having to say goodbye to him, plus 3 hospital bills, with no benefit of being undocumented. I remember arriving to my routine appointment, with the doctor tell me that we are sorry, but the baby does not have longer heartbeat. Followed by the statement, they explain me that because I don't have any insurance, they recommend me to go to another hospital or somewhere else. I had to listen to that for 2 more times because in my ignorance and desperation, I was looking for another answer. Finally, I had to wait about 3 more long weeks until somebody else recommended me to go to the abortion center. So they could remove the fetus since none of the hospitals I visited wanted to do it. Because they did not see it any medical emergency, and because I did not have any insurance, they didn't attend me. Fortunately, throughout all this time, I did not have any emergency. But in my mind, the thought of having something that remind me inside of me, and intentionally many of my dreams and beliefs, we were also dying. Well, what's next? Of course, paying the bills, and I have to work for more than a year to pay all of them because I didn't want to have any inconvenience with my immigration status. Immigrants do not know everything, do not all just because ignorance. It's also because of fears of getting sick, and that all your fear resources will go just for pay debts instead of continue to progress. The progress of each one of us, whether our citizens or immigrants, is a result of progress of this country. I wish to have known about the financial assistance programs. I wish to have been seen as a person and had the health resources I needed. I fight because our immigrant children and their parents, aunts, uncles, and grandparents need quality health services. I see the resolution as the beginning of healthcare Hartford. Thank you for your time.
Thank you for your comments. Councilman Hernandez.
So this one definitely, touched me a little bit more. So you're saying that the baby didn't have a heartbeat, and Hartford Hospital said that Hartford Hospital didn't consider that an emergency either. So they said for you to go somewhere else. Did I get that right?
Yes.
You go somewhere else 3 weeks after. So now you have, for at least 3 weeks, you have a fetus there, and that still wasn't considered an emergency by Hartford Hospital.
I went to Hartford Hospital, first choice, San Francis, and at the end, the Yukon.
So, and that took you about a few weeks to go to all of those. So they basically push you from one to the other, to the other, to the other.
Actually, I went to the same day. I spent since 8 in the morning until 11. I remember it was 11 or 12 at night when I left from Yukon Hospital.
So you spent all day walking around the city with the fetus in your belly that it's not alive, trying to figure out what to do. That's just,
I
okay.
was expecting to hear something different. Because I remember when I was in one of the hospital who was first choice, I guess, they said, oh, well, we can do anything right now, but if you maybe want another opinion, you can go to another hospital. Of course, at that moment, I want to hear something different. So, okay, I'll go to another hospital. And I went to another hospital. In that moment, what they recommend me at that point, they recommend me San Francis. They called them. So when I arrived to San Francisco Hospital, it seems that they expect me to be there. So they do again the whole exams. And they say, well, yes, that's true. Sorry. Yeah, that's what is happening. No heartbeats exactly. So, but actually this procedure is really expensive. So, but you don't have fever, you don't have bleeding, you don't have anything. So you have to do another procedure. We cannot do it here. Or maybe you can go and visit what's the name? Social workers. And maybe you can talk with them. And of course, I don't want to talk with social worker at that moment. You want to hear something different, of course. And that's what I did. Somebody else, I was with somebody else at that moment. It was kind of a friend, and she recommended me. I went to Yukon, and Yukon, they always help me. They always bring me some another resources at that point. So that's why I went with this lady, with my friend at that moment. We went to Yukon. She helped me to move because until that point, I was moving with bus, and we went to Yukon with her. And of course, what she decided to do is like, okay, you have to explain it that you have a lot of pains or whatever. In that way, they can like help you doing something for you. That's what I did. Like I said, no, I have some pains. Can you help me, please, or whatever? At least that's something that I really value from them. It's like at least they give me some other resources or some other answers. Like, okay, we can do anything because you don't have insurance, and actually that one is really expensive. But what we can recommend you is there another organizations, like nonprofit organizations, and maybe they can help you right now. And some of them, they gave me a list, and that's why I visited one of them.
Okay, how long ago was this? ¿Cuánto tiempo fue? ¿Hace cuánto tiempo?
Like 5 years.
Okay. All right. Gracias. Thank you.
Okay.
Estel, ese es tu nombre, ¿verdad, Estel?
Sí, correcto.
Okay. So Councilman Hernandez asked you 5 years ago, and the reason why we ask is that when we have conversations with any of these hospitals, by us knowing when it happened, they can tell us who was the staff person, if the staff person is still there, right? So you didn't actually go to the emergency room. You went to their clinic First Choice, which is on Seymour Street. Is that correct?
That's I remember that's in East Hartford, near to the main street. I don't remember what is the name exactly of that avenue.
Council President, First Choice is a community health center located in East Hartford.
Okay.
On Main Street.
But did she say she went to Hartford Hospital first? I'm just trying to.
I went first to Hartford Hospital, but it's one
emergency room. The emergency room?
No. The first one was in Women's like a stop or
Women's Health.
Es una en la esquina. It's one in the corner.
Street. Yeah, Hudson Street.
Yeah.
Okay. Thank you. I'm so sorry that you went through that. Are there any other questions from my colleagues? Okay. Next to speak is Aranza Nolasco.
Oh, Aranza is actually sick, but I can read her testimony for her.
Sure. Thank you.
Hello. Yes. Hello. Good afternoon. My name is Aranza. I'll tell you about my experience and one of the many reasons why it's important to fight for access to health without barriers. For this local campaign, this is just one example of why we demand all of this. I have had many appointments with my son where he has had bad conditions and bad moments where I need a translator because my primary language is English. Either is Spanish, primarily because I don't know how to, perfectly communicate in English. And then, of course, in terms of medical matters, it's better not to take any more risks when it comes to health of your little one. I had one of many situations where I was talking to a person who was translating something, and what I heard the doctor saying was something very different from what I was expressing, in my opinion, and that is very dangerous in a delicate situation since it's not the same desired result for the condition. It's important that there is quality interpretation for the good of us and for the good of the little ones and the elderly. People in general and the interpreters know many terms that the doctors know and how to express them in a manner that is accurately. This is why I support this resolution, and I hope that you will too. And Aranza is actually one of our most recent members. So I know a lot of these, situations sound like they've been for many years, but we're here today because it's a consistent, repeated issue that continues to happen. Even if it happened 10 years ago, 5 years ago, like it's still happening today. So that's the only thing that I wanted to add. No.
Thank you for reading us her comments. Are there any questions from my council colleagues? So I've called everyone on our list. Is there anyone that wishes to address this council body that has not done so?
Oh, excuse me?
Yes.
I believe Teresa, I also put the name for Teresa Rosario.
Okay, she can speak to us. Go ahead.
Okay, great.
Okay, ya.
Yeah.
Sí, buenas tardes a todos los distinguidos concejales. Mi nombre es Teresa Rosario, estoy casada, tengo 3 hijas y 6 nietos. Soy puertorriqueña y vivo en Hartford hace más de 40 años. Soy una persona muy activa en mi comunidad y soy miembro destacada del comité Hacer Camino Conérico, Comité de Lucha.
My name is Teresa Rosario. Good evening, everyone. I'm married and I have 3 daughters and 6 grandchildren. I'm Puerto Rican and I have been living in Hartford for more than 40 years. I'm a very active person in my community and I'm a leader with Make the Road Connecticut, the Fight Back Committee.
Apoyo la resolución de acceso a la atención médica para que la comunidad pueda tener la mejor salud posible.
I support the access to healthcare resolutions so that the community can have the best health possible.
Sí, en mi pequeña historia, hace pocas semanas que sucedió. Esto es lo más reciente. Cuando fui al hospital para un chequeo, utilicé el sistema telefónico de interpretación para la traducción de inglés al español. Porque había recibido muchas amistades diciéndome que ese problema existía de la traducción. Y yo pues dije, esta es la oportunidad de yo verificar si eso está ocurriendo o no.
This is my little story from very recent when I went to the hospital for a checkup and I utilized an interpretation phone system for English to Spanish translation because I kept hearing from my friends about the interpretation of poor quality.
Aunque puedo entender y hablar inglés, mi idioma preferido y principal siempre ha sido el español. Mi experiencia no fue buena, por decir algo. El sistema telefónico tardó mucho tiempo en configurarse y una vez que el intérprete comenzó a interpretar la conversación, fue difícil entender lo que él decía.
Although I can understand and speak English, my preferred primary language has always been Spanish. My experience was not good, to say the least. The phone system took a long time to set up, and once the interpretation did begin to interpret the conversation, it was hard to understand what the interpreter was saying.
Recuerdo explícitamente que se malinterpretaron frases, por ejemplo, yo sabía que era físico, pero él decía como popsicle, algo así por decirlo, ¿verdad? La persona era un caballero, no hablaba inglés bien, no hablaba español bien. Era algo como una persona oriental y nunca lo podía entender, nunca él me podía entender a mí, a pesar de que yo le hablaba en los 2 idiomas.
Although, The phone system took a long time to say. Oh, I explicitly remember the phrases being misinterpreted. For example, I kept saying it was a physical, but it was just being misinterpreted. And there was never a point where me and the interpreter understood each other, even when we both spoke English or Spanish. And it left me very frustrated.
Sí, al quedarme muy frustrada, pude entender cómo las personas se sienten cuando no pueden hablar el idioma materno de ellos. Es muy triste que todavía en este momento no han mejorado el problema de la interpretación aquí en la ciudad de Hartford, en los distintos hospitales o clínicas. Es muy esencial tener una interpretación de calidad para que los pacientes puedan dar su opinión porque afecta a nuestra salud.
I understood when folks felt like they couldn't speak their native language, that I understood the frustration. It was really sad to have a moment where the interpretation felt like it wasn't improving for hospitals and clinics. It's essential to have quality interpretation that patients can give feedback to because it impacts our health.
Al sentirme tan frustrada, fui un poco ruda y ni las gracias le di, solamente colgué la llamada.
I'm being so frustrated. I was a little rough and didn't say thank you and just hanged up the call.
Este es un solo paso hacia el logro de servicios de salud de calidad para la comunidad inmigrante. Gracias por su atención y espero que puedan entender mi petición para todos los que necesitan, porque todos somos seres humanos y necesitamos un servicio de salud de primera calidad. Gracias. Muchas gracias.
This is only the first step towards achieving quality health services for the immigrant community. We're all human beings and we deserve, quality health services. So thank you so much for your time.
Thank you. Is there anyone else that wishes to address this council body that I have not called on? Is there anyone else that wishes to address this council body that I have not called on? That concludes our public comment section. Thank you, everyone, for your comments. Have a good evening, and please join us shortly for our regularly scheduled virtual council meeting. We will take a 5-minute break and then go right into our council meeting. I'll see you guys soon. Thank you. This meeting is adjourned.